You won't believe what your body might be hiding. That weird pain, sudden sweat, or even a vanishing mole could mean something way more serious. Some say it's nothing. Others aren't so lucky. Stick around. Your life might literally depend on it. Don't forget to subscribe. When your voice doesn't bounce back. You wake up with a scratchy voice. No big deal. Maybe the air was dry or you talked too much yesterday. Days pass, then a week, then two, and your voice, still raspy, still weak, still wrong. At first, it's just annoying. You sound like someone's been sandpapering your vocal cords. But after a while, it becomes something else, concerning. Your vocal cords are tiny muscles that vibrate together every time you speak. They're delicate, and they usually bounce back. But when that hoarseness sticks around, your body might be trying to flag down your attention. Sometimes allergies or silent acid reflux can irritate your throat. Other times, small growths like polyps form and throw off your voice. But in rare cases, something deeper could be pressing on the nerves that control your vocal cords. Doctors have a golden rule. If you've had a raspy or strained voice for more than 2 weeks, don't guess. Get it checked. It could be your body's way of saying something's off, even if you feel fine otherwise. That creepy gray ring in your eye. You're brushing your teeth, look up at the mirror, and notice something strange in your eye. A faint grayish ring circling your iris. It doesn't hurt. Your vision's fine. You might even think it's just a reflection. But that little ring, it's not for decoration. It's actually a deposit of fat, specifically cholesterol, that's found a new home in the Schleue outer edge of your cornea. This condition is called corneal arcus, and while it's common in older adults, it raises more eyebrows when it shows up in younger people. If you're over 60, it's usually harmless. But if you're under 50 and seeing this ring, it could be a signal that your cholesterol levels are far higher than they should be, and that your heart is quietly under pressure. The ring won't interfere with your sight. In fact, many people don't even notice it until someone else points it out. But just because it's silent doesn't mean it's safe. Your eyes could be silently pointing to a cholesterol imbalance that's worth acting on before anything else surfaces. When a mole just disappears. You're getting dressed and something feels off. That little mole on your shoulder, gone. Completely. No redness, no scar, no explanation. It might sound like a lucky break, a free mole removal, but in reality, it might be your immune system fighting a battle just beneath the surface. Sometimes the body mistakenly sees a harmless mole as an intruder and attacks it, creating a white halo around it. Over time, the mole fades, leaving behind a pale patch of skin. That's called a halo nevus, and it's usually benign. But here's the part most people don't know. Moles don't just vanish without a reason. In some cases, your immune system might be reacting to changes inside the mole, changes that could be a warning. Even when the mole disappears, the cells that cause concern may still be active deeper in your skin. Dermatologists use the ABCDE method, asymmetry, border, color, diameter, and evolution, to track changes. And yes, evolution includes a mole going missing. So if one of your moles quietly vanishes, don't just shrug it off. That disappearing act might be your skin's way of calling for backup there. When your coffee smells like garbage. Picture this. You wake up, walk to the kitchen, and pour your usual morning coffee. You lift the cup to your face and nearly gag. It smells like rotting trash. At first, you think the coffee's gone bad. You try bacon. That smells off too. Chocolate? Even worse. It's not your food, it's your brain. This bizarre glitch is called parosmia, a condition where your sense of smell becomes scrambled. Instead of sensing delicious aromas, your brain reinterprets them as foul, repulsive odors. This can happen after something as minor as a cold or sinus infection. Sometimes a head injury is the trigger. The nerves that control your sense of smell get damaged. And when they try to repair themselves, they reconnect the wrong way. The result? The smell of coffee might register as garbage, bacon as sewage, chocolate as smoke. And since 80% of taste is actually smell, your meals suddenly feel like a punishment. It's not just frustrating. It can affect how much you eat, how you feel, even how you function. If your favorite foods suddenly smell like something out of a horror movie, it's time to listen. Your body could be sounding a quiet alarm. The weird yellow bumps that aren't just skin deep. You notice a tiny, soft yellowish bump on your eyelid. It doesn't hurt, it's not itchy, so naturally you ignore it. A few days later, another one appears. maybe on your elbow, maybe your knee. What you're seeing could be xanthomas, small fatty lumps forming under your skin. They're made of cholesterol that slipped out of your blood and settled where it shouldn't. Alone, they won't cause pain, but they could be revealing a much bigger problem inside you: dangerously high fat levels in your blood. Xanthomas are often linked to unmanaged cholesterol, blood sugar imbalances, or even problems with how your body handles fat overall. Think of them as tiny warning flares, not about your skin, but your entire circulatory system. They can show up anywhere, around your eyes, on your hands, feet, even your back. Some are barely noticeable. Others grow as large as a coin. If you spot one, don't dismiss it. That little yellow bump might be the only visible sign that your bloodstream is overloaded, and your heart is feeling the weight. The drumstick finger you didn't ask for. Take a close look at your fingertips. Are they rounder than usual? Puffy? Do your nails curve downward like little spoons? This could be finger clubbing. And while it might look harmless, it's actually one of the body's more subtle cries for help. It usually means that not enough oxygen is circulating in your blood. And when that happens, your body compensates by growing extra tissue at the fingertips. The result? Bulbous tips, soft nail beds, and nails that look like they're floating. And while clubbing isn't painful, it's often linked to conditions involving the lungs or heart. There's a simple home test. Press the tips of your index fingers together. If you see a small diamond-shaped window of light, your nails are probably fine. But if that space is completely closed, it might be time for a deeper checkup. Your fingers might look unusual, but it's what's happening beneath the surface that matters most. When night sweats turn into a mystery. It's the middle of the night. You wake up drenched, your shirt soaked, your sheets clammy. You didn't have a nightmare. The room isn't warm. And yet it feels like your body ran a marathon while you were asleep. This isn't just regular sweating. These are night sweats. And when they show up regularly, without an obvious cause, they could be signaling a deeper issue. Sometimes it's simple: anxiety, stress, or even an overly warm blanket. Certain medications can also mess with your body's internal thermostat. But if the sweats keep happening, and especially if you've lost weight recently or feel unusually tired, your body might be fighting something internally. Your immune system could be launching an attack, raising your core temperature like a built-in alarm. Once the battle ends, your body cools down the only way it knows how: sweating. A lot. If you're waking up soaked more than once or twice a week, it's worth asking what's going on beneath the surface. Your body might be cooling down, but it's trying to turn up the volume on a hidden problem: the static limb that won't wake up. You've been lying in the same position too long. Your arm feels like static. Pins, needles. You shake it out. No big deal, right? But what if the tingling doesn't go away? Persistent numbness or tingling in your hands, feet, or limbs isn't just annoying. It could mean your nerves are under constant stress. One common cause? A lack of vitamin B12. This nutrient helps keep your nerve insulation intact. Without it, nerves fray, like exposed wires. Other times, a nerve is being compressed, like in carpal tunnel syndrome, or something deeper, like an underlying health condition, is affecting how your nerves function. It doesn't always hurt. That's what makes it easy to ignore. But that lingering tingling, it's your nervous system sending out a steady stream of alerts, hoping you'll finally pay attention. When pain shows up in the wrong place. Here's a twist. What if the pain in your arm isn't actually from your arm? Your body has a weird way of misinterpreting danger. Sometimes when something's wrong inside, like with your organs, the pain shows up elsewhere. This is called referred pain. The nerves inside your body share communication lines with your skin and muscles. So when your heart, liver, or kidneys send a distress signal, your brain might pin the pain to a completely unrelated place. Left arm pain? It could mean your heart is under stress. Pain at the tip of your left shoulder? Maybe your spleen. A dull ache in your lower back? Your kidneys might be calling out. It's like your body is sending a message to the wrong mailbox. That's why it's so easy to overlook. So if you feel pain that seems random, persistent, or just doesn't make sense, listen closely. Your body may be trying to tell you something. It's just not great at directions. Here's the thing: your body rarely stays silent. It whispers, it hints, and sometimes it yells. A fading mole, a lingering cough, a strange smell. These aren't just quirks, they're messages. And the sooner you learn to read them, the better chance you have at staying ahead of something bigger. So the next time something feels off, don't just brush it off. Drop a comment. Have you ever had a weird symptom that turned out to be something important? Share your story. It might help someone else notice a warning sign they'd never considered.